Hello, today I'm going to talk with you about Down syndrome. Okay, all the images I took from Google search. Okay, now before I start talking about the clinical features of Down syndrome and the concept like how it happening, the patterns of happening, the risk of recurrences, first I would like to tell you what is meant by a trisomy. Okay, as humans, we are made up of cells, millions, billions of cells. Okay, and within these more cells, except mainly red blood cells, we have a small parliament-like area. Like in the country, our parliament has parliament members. Within those all cells, inside their small parliaments, within each cell, they have small parliament members called chromosome. Okay, and in a country, we have a one parliament, and in our country there are 225 parliament members, and they belong to several different parties. But within our cells, I told each cell has a separate parliament. That parliament we call a nucleus. Inside that nucleus we have chromosomes. Those are like parliament members, but in the cell there are only two parties of chromosomes. Those are either from the mother or either from the father. Okay, there are 23 from the mother and 23 from the father. So as I said, we get 23 from mother and 23 from father, altogether 46. So among that 46 chromosomes, 44 chromosomes, we call them autosomes. Okay, and rest, that means 2 chromosomes, we call them sex chromosome. That will determine the gender. Okay, whether it's a male or female. Male has XY chromosome and female has XX chromosome. Okay, that also one coming from the mother, one coming from the father. Okay, and one additional thing I can explain is that X or Y, that determined by mainly by the father, because mother has only X chromosome, so she can only give X chromosome. Father has X and Y, so he can give X or Y chromosome. If he give X chromosome with the mother's X chromosome, that is 2X, that's the girl. If father if father give Y chromosome, then X and the Y, that is a boy. So the gender of the baby is determined by the chromosome, the sex chromosome derived from the father. That's additional point I described here. Then about the autosomes, we have 44 chromosomes that we name from 1 to 22. So there are 22 autosomes, that one pair from mother and one pair from father, altogether 44. So with that 44, with that additional 6 chromosome, we have altogether 46 chromosomes. So why I explain all this is I want to tell what is trisomy. Trisomy is we have one extra chromosome. It can be either from the mother, either from the father. If that one extra chromosome occurring in the sex chromosome, or that means it can be a one extra Y or one additional X. That is not that problematic. Yes, they have some problems, but that is not life-threatening. That is not that is not a major problem. Okay, but if that extra chromosome from mother or father came from that 1 to 22 pairs, it can lead to huge problem. Even that fetus can die inside the mother's womb. Okay, if that baby is having one extra chromosome 1, surely he or she will die, because chromosome 1 is a huge chromosome that has huge number of genes that produce lot of protein. That excess amount of protein the fetus can't bear, and he will pass away within the uterus. Okay, even the chromosome 2 also same. It's a big chromosome with huge number of protein coding regions called exons. So more and more protein will be produced than necessary will pass away. Okay, it's same for chromosome 1, 2, 3, 4, 5, 6, all those chromosomes. If even a single one extra chromosome 1 or 2, 3, 4, 5, even a single one, we can't live, we can't be born. Okay, so who can survive as trisomy? That is trisomy 13, 18, 21. How that happened? The reason is those chromosomes contain relatively less amount of protein coding regions or exons, and relatively they are producing less amount of protein. So the amount of excess protein the fetus has to handle is less compared to a trisomy from the chromosome 1, 2, 3, 4, 5 like other chromosome. So trisomy 13, they have one excess 13 chromosome. Trisomy 18, other than that 46 chromosome, they have additional 18 chromosome. So number 18 is extra, there is a 1 extra. So altogether the trisomy 18 has 318 chromosome. Today our topic is trisomy 21. So they have one additional 21st chromosome. So all the other chromosomes in pairs, but we have a triplet of 21st chromosome in trisomy 21. I think now you are clear what is a trisomy and why other trisomies are not surviving. And among the trisomies surviving till birth, among the autosomal trisomies, 13, 18 and trisomy 21, I need to tell trisomy 21. Among that three types, trisomy 21 is the best one, because most children born as trisomy 13, 18 unfortunately passed away within first 1 to 2 years, because they can't handle that excess amount of protein, the excess amount of genes that is there in each cells of their body in excess. I told that small parliament are within each cell. Within that each small parliament like nucleus, they have excess amount of one chromosome producing huge number of protein that is not bearable. Okay, but chromosome 21, people live with chromosome extra 21. That means trisomy 21, some with good lifespan, some with good intellectual ability, and so their clinical manifestation varies from person to person. Okay, this Google image, I found these images from Google searching. Okay, and let's move to see their clinical manifestation first. Okay, then later we'll talk about the mechanisms of occurrence of the trisomy 21 and about some counseling I'll try to do, but this is not a medical advice, this is just an educational video only. So their face, they have flattened face, and their head, they have small head, we call it microcephaly, and their neck, they have short neck. In the mouth, they have protruding tongue. Their eyes, upward slanting eyes. That means the lateral corner of the eye is higher than the medial corner. They can have epicanthal fold, that is in the medial side of the eye, they have some extra fold of skin. Okay, they have short height, and their ears are small. We'll move to another image now. Here also same, small ears, slanted upslanting eyes, flat nose bridge. Okay, so that thing also you need to remember. And they have short neck. In the eyes, in the iris, there are a tiny white spot, we call it brush peel spot. Compared to a normal person, they have hypotonia, that is more clearly visible, clearly we can identify when they are infant. Okay. And they are occiput, that means back of the head is flat, we call it brachycephaly. In the hand, their fingers are short, broad, and in the palm single crease, single cement crease is there. Okay. Then they have excess flexibility. In the foot, they have wide sandal gap in between the first and the second toe. Okay. Then about testing to diagnose a person with trisomy 21. Okay. Another name previously used was Down syndrome. Although that when we hear the word down, we feel like something is down, something is low. But here something is extra. That is 21st chromosome is extra. Okay. And the test we do to find out any comorbidities, like they can have heart defect. So we need to do echo, and they can have coexisting thyroid problem, thyroid function test, need to check for their vision and the hearing, and then later we need to find out supportive groups and speech therapy or rehabilitation. Like that, we need to provide specialty involvement for the benefit of the patient. So then I told that we don't need a karyotyping to diagnose Down syndrome. Then why we do this? The reason is we need to find out the risk of recurrence within the family or within the relatives. The reason is Down syndrome can occur with mainly three main varieties. It can be due to non-disjunction. That can be it's like a by chance. The chance of non-disjunction increasing with the when the paternal or maternal age is rising. The other mechanism is it can be due to Robertsonian translocation. Okay, I will explain that. In that case, there's a one variety, 100% each and every child born to that family will be having Down syndrome if it is due to 21-21 translocation, Robertsonian translocation. Okay. Then there's another variety, that is a mosaicism. Then we'll talk about them now. If it is not clear, I'm trying my best to explain it with simple word now. Okay. First variety is non-disjunction. Okay. About here we need to talk about the meiosis. In meiosis 1, in a previous video I told, right, in meiosis we know that cell cycle, it's occur in the gametogenesis in the both male and the female. So in the cell cycle, it's a G0 phase is resting, then G1, then the S phase, then the G2 phase, then it goes for the PMAT. PMAT means prophase, metaphase, anaphase, telophase. Then the, okay, you know that that's the steps in the cell cycle. Okay. Then in the meiosis we have two PMATs, and I think it's better to go to that meiosis and mitosis and cell cycle video, otherwise this video will be very lengthy one. Okay. Then in the meiosis 1, all we know there is a homologous chromosome pairing, and then in the meiosis 1, in the metaphase 1, that homologous chromosome will get separated in the anaphase 1 of the meiosis 1. Okay. So when going to the meiosis 2, the cells will usually have 23 chromosomes. Okay. If that is not occurring, that means two homologous chromosomes of the 21st going to the same daughter cell, that is a non-disjunction occurring in the meiosis 1. So that cell is having two homologous chromosomes of the 21st within their cell. That is not supposed to be. They are supposed to go to two daughter cells in the meiosis 1. So if that cell is viable during the fertilization, there is a chance of the fetus having 3 copies of 21st chromosome. That is a one method. Then the second method of non-disjunction, that can happen in the meiosis 2. In the meiosis 2, we know the cells come to the meiosis 2 are having 23 chromosomes, because already in the meiosis 1 homologous chromosome pairs are separated now. Now cells contain 23 chromosomes and they have sister chromatid, and in the meiosis 2 the sister chromatid separation is the thing happening. So ideally two sister chromatid from the chromosome 21 also need to be separated to two daughter cells. So if non-disjunction occurring in the meiosis 2, that means two sister chromatids is going to the same single daughter cell. Okay, in that case